Meanwhile, health experts are trying to figure out if spoiled doses of the Moderna vaccine shipped to several states, including Maine, could actually be salvaged.
The Maine CDC says it's a possibility. News Center Maine's Zach Blanchard explains.
More than 4,000 doses of the Moderna vaccine shipped to Maine this week deemed unusable.
The indicator was pointing towards the red X.
Or so we thought. The game changer, Maine CDC Director Dr. Nirav Shah now says it's possible those vaccines may have been stored at too cool a temperature, not too warm.
Being too cold increases the chances that the vaccines that were delivered to Maine, those 4,400 doses, can eventually be used.
Let's break it down. The Pfizer and Moderna vaccines have a lot in common. Both require 2 doses. Both were made using mRNA technology, and each is about 95% effective. But they're different in one key area, storage temperature, which impacts who gets which vaccine. Moderna says its vaccine must be kept at -4 degrees, which is about as cold as your typical freezer. The same place you might keep a frozen pizza or that bag of peas you'll never eat. But the Pfizer vaccine requires storage at -94 degrees. That's colder than winter in Antarctica and much colder than your typical freezer. So if the Moderna vaccine was kept too cool, does it ruin the doses? Well, it's not so clear.
Now, we do not at this time know when federal officials and scientists will complete their analysis of what precisely happened here and what it means for the ultimate viability of this vaccine.
Dr. Shah says it's now up to those health experts at Moderna to determine if that's the case. In the meantime, those doses are being kept out of patients' arms.
Not one of those doses has been administered to anyone in Maine.
Another challenge in the race to vaccinate. This one too cold and too close to call. Zach Blanchard, News Center, Maine.
And officials say those 4,400 doses will be kept in storage until a final decision is made. They have since been replaced.